Shoulder impingement. Do you feel a sharp pinching pain in your shoulder at certain angles? Now, before we address the topic for today, for those of you who don't know me, my name is Swati. I'm a physiotherapist or physical therapist, and I do these videos because I strongly believe in patient education and letting people know why they are getting the symptoms that they have or teaching them self management strategies. Okay, so if you're watching me on the Facebooks or on Instagram, go over to my YouTube channel after this. And if you like what I'm talking about, please do subscribe to my channel and press the bell icon if you want to be notified of future videos. Okay, if you're watching me here on the live, can you say hello so I know you're here? And if you're watching me on the replay, then please comment hashtag replay so I know you've been here. Okay, so moving on to our topic for today is shoulder impingement syndrome. So basically, it is a set of symptoms that you have. It's not really a diagnosis because it can happen from a various number of issues happening in the shoulder joint. Okay, so first things first, what is an impingement? So basically, shoulder problems are the third most common problem seen by the orthopedic surgeons or orthopedicians or physical therapists, in which shoulder impingement is a very common problem. Okay, so we spoke about the rotator cuff injuries the last time. So moving on from there, when your rotator cuff tendon, okay, let's first see what is a tendon. Okay, so if you look at this bulk of the forearm here. So they originate from a bone over here. This is the bulk of the muscle, and then it comes and splits into these four tendons. So these ropey muscle part that you see here, these are the tendons. So basically, the end of the muscle that attaches onto a bone is known as a tendon. So simple enough. It's just the end of the bone. It's more ropey rather than more muscular, as you see here on the forearm. Okay, so that's just one example. So what happens is a rotator cuff, for those of you who did not see the previous video, you can go back and see it on my YouTube. But those of you who didn't see the video, it's rotator cuff is a set of four muscles that is running from your shoulder blade on top of the shoulder blade and underneath the shoulder blade. They run from your shoulder blade onto your long bone here in the arm, right? So they come and attach here. Now, what happens is we have a joint here on the shoulder, which is present between your collarbone, the clavicle here, and if you trace your shoulder blade, if you trace your shoulder blade out to the side here, so these two bones, they join together and they make a small joint known as the AC joint or acromioclavicular joint. Yes, we've spoken about this in our shoulder series as well. So again, the videos on YouTube. So there is this joint right here, and then you have your ball and socket joint for your which is usually people call the shoulder joint, right? So you've got your ball and socket joint sitting right here, right? And then you've got this small little joint here. In between those two is a very narrow space where your rotator cuff tendon comes and then attaches onto your upper arm here. So that very narrow space actually has a bursa as well. Now, bursa is a fluid-filled sac, so more like a balloon. So what happens is there's this bone on top, this bone below, and there's this bursa here which protects the rotator cuff tendon so that it doesn't rub against the underside of the joint on top here. So basically, it's a very complicated and a very narrow space there, right? Can call it faulty designing, but then it's there for a purpose. Anyway, so let's not get into too much of the anatomy of it. So basically what happens is when your rotator cuff tendon is passing through that very narrow space, if for some reason, we will cover the causes after this, if for some reason the rotator cuff tendons are getting pinched when my arm is at a certain angle. So that's why the topic said you feel a pinching in your arm at a certain angle, right? So when you're at a certain angle, usually around here, you will feel a sharp pinch inside your deep inside your shoulder joint. That is your rotator cuff tendon, which is getting irritated at a certain angle, right? So what is happening here is, if it is getting irritated, and if there is irritation, there tend to be a bit of inflammation, and swelling is a part of inflammation. So swelling comes in. When there's swelling in a very narrow area, obviously there's more rubbing on the tendon. So more rubbing on the tendon, more irritation of the tendon, more swelling. Then swelling leads to more irritation. So it's like a vicious cycle that goes on and on. So basically, that's what is happening, and that is why you're getting that impingement. So when you are actually doing the movement, there's not enough space for that tendon to glide around, for those bones to actually do the movement that they're supposed to do without pinching onto that tendon. So that's when you get your impingement. So basically, it's just the tendon getting pinched. Okay. Now, why does it? What will happen apart from the pain? The other symptom, when you're not moving your arm, you might be pain free, but most of the times you will feel a throbbing pain within your shoulder, more like a toothache, right? Rather than a muscle tear sort of a feeling where you have a sharp pain, you will feel like there's like a, you know how you've got a toothache, you feel really dull, achy pain in your tooth. You feel that deep seated, dull, achy pain inside your shoulder joint. Okay. So now the main activity of your rotator cuff basically is sideways lifting of the shoulder. So lifting your shoulder sideways here, and also rotations. Okay. So these sort of movements. Okay. Sorry. So what happens is, usually if you're going to do some overhead activity, suppose I'm picking up something from, say, this area here, and I'm putting it in a shelf above my head, right? The overhead activities will get painful. And also um, any activities where I have to go sideways, right? So if this is 90 and this is 180, right? So between 60 and 120 degrees of this movement, called the abduction of the arm, this will be quite painful, and this is usually where you feel that pinching. Okay, shoulder muscles can get weak with time, and if this is a chronic condition, which it usually turns out to be, because initially people ignore it, and then when they come to us, by the time the patients come to us, it's usually chronic or subacute, right? Going towards a chronic condition. Chronic condition, then what happens is you start to get this pain traveling up into your neck as well. So sometimes your cervical spine is also involved, especially if you have a pre-existing cervical problem, then your cervical spine can get involved. Okay. Now, sorry, I'm just looking at my notes. Yes. Another thing is pain in the night. So if you're sleeping on your affected side, this is true for any shoulder problem, but if you're sleeping on your affected side, you will usually have pain. And in this case, the pain can be sharp shooting because it's already inflamed. The area's got a lot of inflammation. On top of that, you're putting pressure. So obviously, you're going to get pain when you're sleeping at night. So okay, so there is a shoulder weakness, there's pain when you're sleeping at night. You can have an involvement of your cervical spine as well. But what happens? Why do we get this impingement? So what happens is, as I said, this is a narrow area. It If you have like you're born with an acromion. So acromion is basically, your shoulder blade when it's coming. If you trace it this way, so this bony part here, that's the end of that shoulder blade that joins with the clavicle, with the collarbone, and forms that joint on top. If your this bony part here is not in the exact shape that it's supposed to be, but it's like hooked or curved, it can you imagine if the joint is supposed to be like this and your tendon is underneath? Okay, so the tendon is gliding, there's no problem. But if your joint, one of the bones is actually curved or hooked, obviously it's going to start irritating and rubbing on that tendon there, right? So if you have bone that has arthritis and it's got osteophytes or those little bony growths there, and they can start rubbing on the tendon as well. So that could be one of the causes. So usually if you look at the books in physiotherapy, we do usually divide the causes into primary and secondary. So primary is something you're born with. It's like there is a mechanical narrowing of the space here where your joint, where your rotator cuff tendon is present. So that would be your shape of the bone or your osteophytes. Secondary will be it could also be due to a functional disturbance. For example, if my pecs are tight, okay, so let's look at one side. Suppose I'm looking at my right side. My pecs are tight, or I have bad posture and I have a rounded shoulders like this. Okay, so what happens? This is your shoulder blade. So if you're looking at the back here, the shoulder blade sitting here, right? This is a normal. But the moment I round my shoulders because I slouch at the thoracic spine or I have a forward head posture, what happens is your shoulder blade is not sitting in its neutral position. It has to also glide along with the whole shoulder complex that's coming forwards here, right? So once it glides forward, can you imagine what imbalance is happening? And that joint that is present on top of this rotator cuff, that is going to start pinching. There's going to be narrowing of the space again because of this postural imbalance here, right? So because my pecs are tight, I sit like this, and because of that, there's narrowing of the space here, and that's why your rotator cuff tendon is now getting pinched. So is also people who do a lot of overhead activities or training, where people are more training on this area. So there are a lot of causes that can cause the impingement, right? So how is it diagnosed? It is diagnosed via a number of tests that your physiotherapist or your orthopedician will do for you, or the surgeon will do for you. X-rays can show you the osteophytes or those bony spurs, or if you have a different shaped acromion, that is the bony end of your shoulder blade there. It can show that. MRI can show you if you have a bursitis. So you remember that bursa, that fluid-filled sac that sits right over the tendon. If there's an inflammation there, obviously it's going to start pinching. It needs to expand. So it's going to start pinching on your rotator cuff tendons. So if you have a bursitis, your MRI can show that. So they can be like they can be a variety of things you can do. You can even do ultrasound imaging for the shoulder to know what's happening in there. So your doctor will decide as to what imaging or tests do you need to confirm the diagnosis. Now, what can your physiotherapist do for you? So a physical therapist will obviously conduct the same tests. They can explain this situation to you. So first and foremost is patient education. I get a pinching pain in my shoulder the moment I move it at this angle. What's happening with me? So patients panic. So patient education firstly. Secondly, if you have a bad posture and because of that you're getting an impingement, so obviously postural correction, which involves sorting out or addressing the muscular imbalances, your stretches, and if you have your muscle weaknesses, then strengthening exercises. Then if say you you are say into sports, it's not that you will never go back into sports. So there's got to be a functional training to get you gradually back into your sports. Even if you're working or you're staying at home, you need to do your everyday activities without that pinching pain. So getting that functional training to get back into your everyday activities. Manual therapy, which can be like gentle joint movements, soft tissue releases, because obviously those tight muscles need to be released. Stretches, and as I said, strengthening exercises, basically a lot of exercises, right? So there's a lot that your physical therapist can do for you, but you need to go there and you need to get this sorted out. Okay, so I hope that gave you a bit of clarification on what is shoulder impingement and how it can cause that pinching pain in the shoulder. I know there was a lot of technical terms here, but I've tried to make it as simple as possible. If you do have questions, feel free to ask me. And yeah, I hope that was helpful for you. And it's a part of our shoulder series that we're doing. So feel free to have a look at the other videos as well onto my YouTube. Alrighty, I hope that was helpful for you. Okay, see you in the next one.